instrumentation and setup. As you can see, I do most of my Contour Thread Lift 1, my CT1 thread lifts in the side office, not in an operative environment. The patient today is having blepharoplasty, she's having some laser resurfacing to the central T-zone, so she's having T-zone procedures. That is why she's intubated. However, most I do in the side office. They do not need to be done in a Medicare Quad ASF type facility, as long as you have a sterile technique. As you can see, a very simple Mayo stand. A very simple Mayo stand is all that is required. The basic instruments would be a driver that you can use to close your deployment and anchor ports, a simple pickup, a non-tooth pickup, a pair of suture scissors, specialty instruments, a dermatologic punch. I use a dermatologic punch, 2.5 millimeters or a 3 millimeter dermatologic punch, as you can see end on here if we come up tight, to create my deployment and my anchor port. To create my deployment and anchor port for the new Articulus series threads. The other specialty instrument you will require for the CT1 is a sharp point dissector. This is a lovely little instrument with a plastic handle. It's a very blunt tip for very safe tissue dissection with a little V-notch. If you look at the end, there's a little V-notch. And this is critical to outcome success with the CT1 and CT2 procedure. For the CT1 procedure, tissue dissection and autogenous fixation requires an instrument like this in order for you to get adequate soft tissue release in an advancement flap. A nice broad tip is safe, but the little V-notch in the end is critical. If you use a blunt tip like a lipo cannula or an 18-gauge needle, it just pushes tissue out of the way. The V-notch secures and snares that tissue and avulses it when you're in the mid-fat plane, allowing for adequate mobilization of the flaps, as you will see. So if we come back out, the sharp point dissection needle is important for the CT1 procedure. And if you like to work through tiny holes rather than slits, the hole punch, dermatologic hole punch. Then some basic things. You need a pen to mark out the actual procedure, perhaps a ruler to measure. You need a little 30-gauge needle for intradermal anesthesia for your anchor and deployment port and your exit sites. A 25-gauge that I use if there's any bleeding in the scalp for additional tumescent infiltration. And then I create my tumescent tunnels, my pre-dissected tumescent tunnels with a 22-gauge spinal needle. This is a 22-gauge spinal needle that we will use to do much of our hydrodissection. You'll find the needle passage much simpler if you do an excellent hydrodissection with your 22-gauge needle. And then when we talk about local anesthesia, I'll talk about why I use 5cc syringes and the safety of using a 5cc syringe with your tumescent infiltration. And then we do put some cremants in the hair because there is often blood loss because the scalp is very vascular, and a comb to comb the cremants through the hair in order to minimize disfiguring red colors after when you're washing out the hair. The comb's helpful. So these are the things we put on a simple Mayo tray in a side office procedure in a clean, sterile environment.